Will I see the scalpel coming at my eye? That's one of the most common questions I hear from patients scheduled for cataract surgery. And I get it. The idea of being awake while someone operates on your eye sounds terrifying. You're imagining instruments, bright lights, maybe even seeing a blade as it enters your eye. But here's the blunt truth. What you actually experience during cataract surgery is nothing like you're imagining right now. You will not see a scalpel or a blade. You will not be watching the procedure in the traditional sense, and you definitely won't be in significant pain. What you will experience is something completely different. A light show, swirling colors, pressure, with very minimal to no pain. A process that's more controlled and comfortable than the awful movie playing in your head right now. I'm going to walk you through exactly what happens when you're awake during cataract surgery. No sugarcoating, just the facts about what you'll see and what you'll feel, and why staying awake is actually the safest option for your eyes. Let's start with the question that's probably making you anxious. Why do you have to stay awake in the first place? Well, the answer comes down to safety and precision. Cataract surgery uses local anesthesia, not general anesthesia. So what this means is that we numb your eye completely, but you need to remain conscious throughout the procedure to follow some cues. And before you panic, understand that local anesthesia for your eye is incredibly effective. You will not feel the cutting, and you will not feel severe pain. The surface of your eye and the surrounding tissues are numb. Well, why not just put you to sleep, people ask? Well, because keeping you awake gives us, the surgeons, significant safety advantages. When you're conscious, you can follow simple commands. Look up, look down, look to the right, left, hold still. That communication matters during a delicate procedure on such a small, precise structure. If something feels wrong or uncomfortable, you can let your surgeon know immediately, and we can adjust and we can respond. With general anesthesia, though, this introduces risks that simply aren't necessary for most cataract surgery. There's breathing tubes, longer recovery times, and then potential complications from the anesthesia itself. The increased systemic risks, especially for older patients or those with heart conditions or lung conditions, and even diabetes, is usually not appropriate. And so by keeping you awake, we can eliminate some of these variables. And here's what patients don't realize. Awake doesn't mean being aware of everything happening. It doesn't mean you're watching the surgery like you're in the front row of an operating theater. And most patients expect that they're going to see everything, the instruments, the surgeon's hands, every step of the procedure in vivid detail. And that's the fear, right? Watching someone work on your eye while you're powerless to look away. Well, the good news is the reality is completely different. Your vision during cataract surgery is controlled. It's blurred, it's limited, and you're not seeing the procedure itself. You are seeing the lights and colors and some abstract patterns, and that's it. Now, I know some of you are thinking, but I'm still going to be terrified. I don't want to be awake at all. And that's a valid concern, and that's why we have sedation options. For very anxious patients, we can provide oral medications like Valium before the procedure. It takes the edge off. It calms your nerves. You're still awake, but you're relaxed. Some patients even opt for IV or twilight anesthesia, which puts you into a deeper state of relaxation. You're technically conscious, though, with these medications, but you're drowsy, calm, and often don't remember much of the procedure afterward. So the key point here is this. You do have options. You're not forced to white-knuckle your way through cataract surgery while fully alert and terrified. But even with no sedation at all, the experience isn't what you're imagining. You won't feel that blade cutting into your eye. The anesthetic numbing drops we use are incredibly effective, and you won't feel sharp pain. You might feel some pressure, you might feel touch, but pain, I can't say no one will feel pain, but I will say it's very minimal. You won't see the instruments in detail also, and your pupil is dilated, so the dilating drops blur your vision. The surgical microscope light is so bright that it washes out any clear view of what's happening from your perspective. So if you're not seeing the surgery and you're really not in pain, what are you actually experiencing? And that's where the light show comes in. So here's what's actually happening when you're lying down on the surgical table, staring up at the microscope light. You will see colors, swirling patterns, bright flashes, geometric shapes that pulse and shift. Blues, oranges, yellows, sometimes reds. It looks like an abstract art show viewed through frosted glass. And that's exactly what it is. The microscope above your eye emits an incredibly bright light. That light passes through your dilated pupil and bounces off the surgical instruments as they move, and this reflects through the irrigation fluid that we use to keep your eye moist and the anterior chamber, or the front part of the eye, inflated. And all this basically creates a kaleidoscope effect in your eye. So your brain interprets all the light and the movement as colors and patterns. And some patients describe this experience as very beautiful. Others just say it's interesting. And a few find it mesmerizing enough that they almost forget about they're in surgery. But here's what you need to understand. You're not seeing the actual procedure. You're not watching us remove your cataract per se. You're not seeing the instruments in any meaningful detail. Why not? Well, because your vision is intentionally blurred. The numbing drops and dilating drops that you put in your eye before surgery don't just numb the surface. They also temporarily blur your vision, making everything hazy. So your pupil is dilated as wide as possible, which further reduces your ability to focus on anything clearly. And the sterile drape I mentioned before, well, that blocks most of your peripheral vision, leaving you only with a narrow field of view, which is directly ahead. All this combines to create an experience where you're aware of light and movement, but you're not seeing anything sharp enough in detail to understand what it is. Now, this sensory experience goes beyond just what you see. You also will likely feel some pressure. Now, this is different than pain. Pressure, it feels like someone is gently pressing on your closed eyelid, even though your eye is open. And this is totally normal. That's us, the surgeons, working on your eye, holding it steady, manipulating the lens. It's uncomfortable in the sense that it's unfamiliar, but it's really not painful. And also you'll hear sounds. The suction device removing fluid, the ultrasound probe that we use to break up your cataract, which makes a buzzing or humming sound. There's also instruments clicking together, and the surgical team talking quietly. All of that is normal. Some patients find the sounds more unsettling than the visual experience, so I'm telling you this now. Expect it. And you might also notice temperature changes. While we irrigate or flush your eye with cool fluid throughout the procedure, you might feel this coolness. And unfortunately, the operating room itself is kept very cold, so you might feel chilly under your drapes. And the entire procedure takes about 10 to 15 minutes per eye. But I'll be honest with you, it often feels longer sometimes. When you're lying still, hyper aware of every sensation, time can stretch. What's actually 12 minutes can feel like 30. However, sometimes with anesthesia, patients feel like it only took 1 minute for surgery. But here's an important reality check. Not everyone sees the same thing. So some patients will see more vivid colors and patterns, while others see less. And this really depends on how dense your cataract is. A very dense, advanced cataract blocks so much light, you might see dimmer or fewer colors or patterns. A less dense cataract allows more light through, creating a brighter, more colorful show. So your eye anatomy also plays a role. And some people just will naturally see more, and some will naturally see less. There's no way to predict exactly what your personal experience will be. But for most patients, the light show is distracting rather than disturbing, and it gives you something to focus on besides the fact that you are having surgery. And I think basically this is actually helpful, because the biggest challenge during cataract surgery isn't what you see or what you feel physically. It's what's happening in your head. So let's get specific about the physical sensations you'll experience during those 10 to 15 minutes. And here's a fear I hear constantly. What if I move? What if I blink? What if I ruin everything? The simple answer is you won't. The medications we give you prevent reflexive blinking. Your eye is held open by the speculum, and your surgeon expects micro movements. Your eye will make tiny movements during surgery, and that's normal. And we will work with that. We adjust for it. You're not going to accidentally cause a complication by moving slightly. But if you're someone who struggles with staying still, or if you have claustrophobia, or the idea of being awake makes you panic, then that's when sedation becomes more important. So how do you prepare yourself mentally for something that sounds this intimidating? First, acknowledge that surgical anxiety is completely normal. You're not weak for being scared. You're not overreacting. Thousands of patients feel exactly what you're feeling right now. The fear is valid. The unknown is scary, and your brain is doing what your brains do most, imagining worst-case scenarios to try to protect you. But here's what helps. Start with your pre-op consultation. This is your chance to ask every question that's making you anxious. And I mean every question. No question is too silly or too small. Ask to see the surgical suite if that helps. Ask to meet the anesthesia team. Ask what sedation options are available. Ask what happens if you panic halfway through. Ask everything. Be honest about your anxiety level. Tell your surgeon if you have claustrophobia. Tell them if you had panic attacks in medical settings before. And also tell them if you have had trauma related to medical procedures. This isn't about being brave or tough. This is about making sure your surgical team can support you properly. Because here's the thing, there's no prize for suffering through this without sedation if you don't have to. If oral Valium will make the experience manageable, take it. If IV sedation will get you through surgery without trauma, choose it. Obviously, you need to talk with your primary care doctor and your surgeon to make sure you're eligible for these medications. Your only job here is to get through the procedure safely and comfortably. And on the day of surgery, use controlled breathing, slow, deep breaths. In through your nose, out through your mouth. This isn't just feel-good advice. Controlled breathing actually calms your nervous system. And visualization can also help. Picture yourself after surgery. Clear vision, seeing your grandchildren's faces in detail, driving at night without the glare and halos that you have now. Focus on the outcome, not the process. Bring a trusted companion with you, someone who can sit with you before surgery, someone who can drive you home afterward, someone who can reassure you when your anxiety spikes. You're not required to do this alone. And here's something that surprises many patients. The second eye is almost always easier than the first. Once you've been through the procedure once, you do know what to expect. The unknown becomes the known. The fear decreases. Many patients tell me their second surgery was different and significantly less stressful because they understood the experience. So in conclusion, let's bring this together. You stay awake because it's safer. The light show you see is normal and not disturbing for most patients. The physical discomfort is minimal and the anxiety is manageable with the right preparation and support. Here's your action step. Write down 3 questions for your pre-op appointment, specifically about anesthesia options and what to expect during surgery. Bring that list with you to your surgeon. Get answers. Being nervous doesn't mean you're unprepared, it means you're human. But those 10 to 15 minutes of surgery lead to years of clearer vision. And that's what matters. Give this video a thumbs up if you help calm your fears, and hit subscribe so you're first to know when I post the next video. And drop a comment below with your biggest fear about cataract surgery. I read every single one. Thanks, and I'll see you in the next video.